aftermath of the Gulf oil spill, BP gave several southern states, and it was a slightly different amount depending on the state. Mississippi received directly $12 million from BP, and this went to the Mississippi Department of Mental Health. Now, the Mississippi Department of Mental Health then established a grant program, and the idea was that people who were directly affected, so these would be folks who might be depressed, severe stress, losing their jobs, and just the tremendous impact of it, people who might be seeking mental health services. And so the idea was that how many sites could be funded. In other words, how could you use that $12 million to maximum effectiveness to help the residents of Mississippi. We were brought in to evaluate sort of how many people served. Is the money actually helping folks? So it's what we refer to as program evaluation, essentially. And so we're tracking 19 different sites that are providing either therapy, outreach type services. We have a team. I work with 2 other faculty members here at the university that serve as consultants, and we have 10 graduate students that worked on the project last year, and we have 10 graduate students working on the project this year.
I actually got into the literature and looked back at some previous studies as well as data we've been collecting and other data from the BP oil spill. You see that it has a long-term effect on people's lives. And even other people in the program, when we first started talking about the oil spill, they thought, oh, this isn't really going to make that big a difference. It's not like Hurricane Katrina, it's not like a natural disaster, but what we're seeing is it really has an insidious effect and sometimes can go really long term.
So I think they get training on many different levels. I think one is just being very community based, and that would probably be the heart of it, I think, or the most important to it, is just sort of thinking outside the box, getting outside of the office and making a difference in the community.
This was very helpful just to get out, I mean, not just, in our community, but in, a community that's 5 hours away, and it's very different than Oxford, to get out and do some research and to actually talk to these people about how they've been affected. And a lot of people who actually run the mental health centers were affected as well by Katrina and the oil spill. So it's been very interesting to talk to them and get their perspectives. That's one of the reasons I wanted to get involved in the program in the first place, not just because of the interest in disaster psychology, but also for the program evaluation piece. I think that's what I'll take away, learning how to work with multiple sites at one time, DMH and the community mental health centers, and to work within our group too to make sure we're doing the job we need to do and that kind of thing.
The biggest piece I take away from it is this collaborative piece between academic institutions, public institutions like the Department of Mental Health, and then the individual community clinical sites. I don't know where I'm going to end up in my career yet. It could be any one of those 3, but I think that what I've taken away from this is the real value in striving for that collaboration and in working together. So I think going forward, it will be learning from the things that didn't go perfectly and improving on those, and then remembering the things that did work well and how to bring those into different projects I'll work on in the future.